Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome back to another session of 3030 with AMCI. Okay, coders, let me know in the chat. How do I sound? Are you able to hear me? Is it audible? Please do let me know in the chat. Okay, so welcome back, as I said, to another 3030 session. It is always amazing to have you all here. Your energy, your curiosity, your dedication make these sessions come alive. And since it's Halloween, we got some special coding treat for you all. Yes, today session we are going to review a topic that every coder must master. I'm talking about the fracture and dislocation treatment. So we will study when to code a closed versus a percutaneous versus a open fracture treatment. And I will walk you through some clear examples to help you understand and remove any confusion. Also, it will help you for your exam and in some real world coding cases. So by the end, you will confidently distinguish between these treatment type like a true AMCI pro. So grab your CPT manual, your highlighters, and that unstoppable AMCI spirit because we are ready to learn and code our way through this Halloween session together. Also, once again, code a happy Halloween and let's make this session a real treat. Let me begin by reading out the copyright. CPT Copyright 2025 American Medical Association, all rights reserved. CPC is a registered trademark of AAPC, and the AAPC content found within this presentation is a copyright of AAPC. Keyword concept FDR Chun, AMCI Fab 7, AMCI ICD 10, Flip Tab, and MCG are the trademark of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials. The credential CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Hello, everyone. Okay, so as I said, we are going to review the fracture and dislocation treatment, specifically the closed treatment, the percutaneous skeletal fixation, and open treatment. So in the CPT manual, the fracture and dislocation treatment codes appear throughout the musculoskeletal system section. And the fracture codes are organized by their anatomical location. That means you will find the fracture treatment codes listed under each specific body part. For example, you can find it under shoulder for shoulder fractures, humerus fractures under humerus, and for arm. So before we jump into the coding part, let's make sure we understand what a fracture actually is. So fracture is simply a break or crack in the bone, and it happens when the bone experiences more force than it can handle. Now, not all the fractures are same. Some might be just tiny, thin crack, what we call a hairline fractures, while others can be complete break where the bone split into two or more pieces. So what causes a fracture? Fracture can be caused by multiple reasons. It can be caused by trauma like falls or car accidents or even sports injury. It can be caused by repetitive stress, overuse injury that lead to small cracks called stress fractures. Also, it can be caused by some diseases, the conditions like osteoporosis or cancer that weakens the bone and make them more prone to breaking. Okay, cool. So now that we know what a fracture is, let's break down different types of fracture you might encounter. Let's start with closed or otherwise called simple fractures. Here the bone is broken, but the skin stays intact. And next we have open fracture. A open fracture where the bone pierces through the skin, which increases the risk of infection. And also there is a transverse fracture where the break goes straight across the bone like a clean line. Okay, I can see that you can't see the image over here. I'm sorry for that. I think my on clicks are not properly working here. Okay, let's move on to the next type of fracture. Next, there is an oblique fracture where the break is slanted or diagonal, not a straight cross. And then comes a comminuted fracture. Here, the bone is shattered into several pieces, and this makes it more complex to treat. We also have a green stick fracture where only one side of the bone breaks while other side will bend. And this is more commonly seen in the children's. And finally, we have something called a spiral fracture. So here the break twists around the bone and it is usually from a twisting injury like a sports accidents. Okay, so these are the different types of fractures. Now let's jump into dislocation. A dislocation happens when the end of two bones that meet at a joint are no longer lined up. And this doesn't affect the bones. It can also stretch or damage the ligaments, sometimes even injure the surrounding muscles, nerves, or blood vessels. And the common sites of dislocations are shoulder, of course, that's the most common site. It can happen in the fingers and thumbs, in the elbow, hip, knee, jaw, and in the temporal mandibular joint as well. So the causes of dislocation, it can be also caused by trauma. It can be caused by the sports injury, especially the contact sports or gymnastics. Also, it can be caused by some congenital or recurrent instability. So here the joints are prone to dislocating easily. Okay, hello everyone. I can see you're coming through. Okay, I can see everyone in the chat. Hello and welcome. Okay, now let's have a look into some of the key definitions which you must know before moving into the fracture coding section. So first comes a manipulation. Now, what is a manipulation? Manipulation is basically reduction of a fracture or dislocation by using manually applied forces or traction to get the bones lined up properly. Now, think of it like a hands-on adjustment. The provider is carefully guiding the bones back into the place so healing can take place correctly. So that's what we call as a manipulation in fracture treatment. Okay, here is a quick but super important coding tip. Sometimes after a fracture or a dislocation is reduced, the alignment doesn't hold and the bone needs to be re-reduced by same physician or qualified healthcare professional. So in these cases, you don't use a whole new treatment code. Instead, you append a 76 modifier to the original fracture or dislocation code. Okay, so that is an important guideline. Now, next up is traction. Another key term you will see when coding fractures and dislocations. So attraction is application of a pulling or a distracting force to the bone or joint, and it usually done on the spine or a limb to help align the bones properly. And there are two types of tractions. One, it can be a skeletal traction where this is a heavy duty version and it uses wires, the pin, screw, or even clamp that actually penetrate the bone to apply force. And we can also have a skin traction. This is a gentler one, and the force applied directly to the skin using straps or adhesives. Okay, now let's move on and let's see what's next. We have external fixation. An external fixation uses a pins or wires that go through the bone and connected by devices like clamps, bars, or rings to stabilize the fracture or dislocations. And it can be used temporarily or long term depending upon the case. Again, there are two types of fixation device: external fixation device, uniplanar and multiplanar. Uniplanar external fixations devices are like all pins that are placed roughly in the same plane through sometimes a triangular configuration which is used across the joint. So uniplanar external fixation means the pins or all the fixation device are lined up in one plane. And then we have multiplanar external fixation devices. So here the pins and the wires are placed in multiple planes held together with a stabilizing or tensioning rings. Okay, again, that simply means pins are lined up on multiple planes. So another coding tip here is that external fixation devices can be used with any type of fracture or dislocation treatment. It can be used with a closed, percutaneous, or even open fracture treatment procedures. And remember, coders, codes for external fixations are reported separately only if the procedure code description doesn't already include it. Okay, so that's another important coding tip. Now let's talk about types of fracture or dislocation treatments, starting with closed treatment. Now, a closed treatment means the fracture or dislocation is treated without surgically opening the site. That means there is no surgical exposure at all. And it may involve no manipulation, that means just a cast or a splint or a strapping to hold the bones in place, or with manipulation, which means manually realigning the bones by the provider, or it can include a skeletal or skin traction, that is using a force to maintain proper alignment. Now, important note is that if a casting, splinting, or strapping is done only to temporarily stabilize a fracture for comfort, it doesn't count as a closed treatment for coding purpose. Okay, all right, goddess. Now let's move on to the percutaneous skeletal fixation. A percutaneous skeletal fixation is a treatment that is neither fully open nor purely closed. That means the bone fragments are not directly visualized. The surgeon can't see them with naked eyes. Yes. So the fixation devices like pins or screws are placed through the skin, guided by imaging tools like fluoroscopy. Okay, so think of it as a minimally invasive way to stabilize the fractures. Now, next up is open treatment, the most direct approach to manage fractures and dislocation. So, open treatment means the fracture or dislocation is surgically exposed for treatment, and this can happen in couple of ways: through traumatic wound or an extension of it. Okay, also by using intramedullary nails or internal fixation devices via surgical exposure, with or without direct visualization of the fracture site. And the open treatment is often required for complex fractures where precise alignment and stabilization are critical for the proper healing. Okay, so these are three different types of fracture or dislocation treatments. And I hope you all clearly understand the difference between these three. All right, coders. Now let's go over some important guidelines that will help you to code the fractures and dislocations accurately. First one, the first cast application and removal are included in the initial treatment. So no extra code is needed in such scenarios. Okay, next one. A subsequent replacement of cast, splint, or strapping and traction device during or after the global period may be reported separately. So only the initial cast application and removal are included in the initial treatment. Well, you can report the subsequent replacement of the cast, splint, or strapping or the traction device during the global period, right? Okay, let's move on to the next one. A cast, splint, or strapping is not part of preoperative care, so do not use a 56 modifier. Okay, next we have if the physician who gave the initial treatment is not the one providing the follow-up care, you have to append a 55 modifier to the fracture or dislocation treatment codes. And if the cast is removed by someone other than original provider who plays the cast, then you can report the cast removal code separately. We got few more to review, few more guidelines to review. So when the surgeon obtains an autogenous bone or cartilage or tendon or fascia lata or other tissues through a separate incision, you only report a separate graft code if that graft is not already included in the main procedure. So always carefully have a look into those code language, whether these grafting procedures are included or not. Okay, next one. If a cast, splint, or scraping is applied only to temporarily stabilize a fracture for a patient comfort, it does not count as a closed treatment, and you should not, in such scenarios, quote for a closed fracture treatment. Finally, external fixation codes are only reported separately when the use of external fixation is not already included in the main procedure code descriptor. So once again, always forensically look into the code language and make sure they are included in the code language or the code procedure description or not before coding the external fixation devices. Okay, coders, I think that's all we have in the guidelines section. We have only few guidelines, but they are very important one. So make sure you join your manual. Now let's move on to some coding exercise. Are you guys ready? Let's begin with the first scenario. Okay, here we go, coders. Of the following, which CPT uh, code most appropriately describes the procedure? Option A 29075, option B 25505, option C 25500, option D 25500, 29075 with a 59 modifier. A 35-year-old patient presents with a simple fracture of the radial shaft following a fall. After clinical evaluation and x-rays, the fracture is deemed stable and decision is made to proceed with the fracture management. The patient is placed in a short arm cast to immobilize the fracture and promote proper alignment during healing. They are advised to avoid heavy lifting and given instructions for cast care to prevent complications like skin irritation or swelling. Follow-up appointments are scheduled every 2 weeks to monitor the healing process through the physical assessment and repeat imaging, ensuring satisfactory alignment and timely recovery of the following codes which best describe the procedure. And I will give you around 2 minutes to answer this one. I know you don't need 2 minutes, but I will run the timer now. And coders, you can place your best answers in the chat. Okay, great answers in the chat. Hmm. Okay, let me walk you through this scenario. Okay, someone has just mentioned that the screen looks small. Okay, so for your information coders, we are having two streams right now. One is for the mobile friendly version, one is a mobile friendly version. So if you are joining us from with the mobile, you can use that window that is specifically for the mobile users. And we also have another stream which is used for the desktop users. So if you're having a desktop right now, you can use the other screen. Okay, hope that helps. And let's start solving this scenario. So we have a patient with a radial shaft fracture and a radial shaft fracture treatment was performed. Okay, and option 29075 is coding for, option A is coding for application of the cast elbow to finger. Now, coders, can we use this code in this scenario? What do you think? Let me know in the chat. Can we use application of the cast in this scenario? Okay, I will give you a tip. Yes, this is the guideline. We all know that initial cast application and removal are included to the fracture treatment codes, right? Yes, it's included in the fracture management. Yes. So, and it was clearly documented that there was a fracture management performed in the scenario. And that means we cannot code the cast application codes alone or with the fracture treatment codes here. There is no need to code a cast application. That will eliminate option A and option D. Yes, both are coding for cast application. I can see an aha moment in the chat. They are priceless. Okay, so yes, so as per the guideline, the initial cast applications are included in the fracture treatment codes, and we are not supposed to code them separately. So that eliminates two codes. Now we are left with option B and C. So I see most of you went with option C. Let's see what they are. Okay, 25505, option B is coding for a close treatment of a radial shaft fracture without manipulation. With manipulation. And option C, 25500 is coding for a close treatment of the radial fracture without manipulation. Now the question is, did we have a manipulation performed or not? So let me pull out the definitions for the manipulation and you can see what it is. So manipulation is defined as a reduction by application of manually applied forces or traction to achieve a satisfactory alignment of the fracture or dislocation. Now, did we have a manually applied force or traction given in this scenario? I don't see. I don't think so. I don't see such a language in the scenario, which means a fracture treatment was performed without manipulation. Yes, there was no such documentation, and that eliminates option B, which makes option C the correct answer. 25500, a closed treatment of radial shaft fracture without manipulation. And you all were spot on. Excellent job, coders. Great job. Great start as well. So let's move on to the next scenario. Here we go. Exercise number 2 of the following, which best describe the procedure. Your code options are option A, 27788, 20696 with a 59 modifier. Option B, 27788, 20696 with a 59 modifier, 27786, 20692 with a 59 modifier, 27792, 20696 with a 59 modifier. Dr. Jessica Wilson performed a surgery on a patient with displaced fracture of the left distal fibular fracture under general anesthesia. Leg was cleaned and prepped, and in a sterile manner. The fracture site was washed with a sterile saline, and the bones were carefully realigned using traction. A multiplanar external fixation was applied with two pins placed above and below the fracture. The position of the fixator was adjusted to ensure appropriate tension and alignment of the fracture fragments with stereotatic computer assistance. Once the alignment was confirmed, the pin sights were dressed and a posterior splint was added for extra support. Patient tolerated the procedure well and was transferred to the recovery room in a stable condition. Of the following, which best describe the procedure? I can see some answers are already in the chat, but your time begins now. You have got 2 minutes. I don't think you need 2.5. You got 2 minutes. You all are doing a fantastic job. And your time begins now, Codus. All the best. All right, coders. I think that is time. Let me have a look into the chat. I can see a couple of answers. How about the rest of you? Give your best answers, coders. Don't worry, even if you get it wrong. Give your best answers. Place your best answers in the chat. Okay, I will wait for a couple more seconds. Oh, okay. So let's start solving this scenario. And I would say brace yourself for an aha moment. And here we have a patient with a left distal fibular fracture. Once again, a left fibular fracture treatment was performed and a stereotatic computer assistance was used. Right? Now let's look into CPT code 27792, that is for an open treatment of a distal fibular fracture, includes internal fixation when performed. Right? Great. So let's have a look into the definition for an open treatment. What is an open treatment? So as I previously said in the beginning, open treatment are those when the site is open surgically to expose a fracture or dislocation to an external environment for a treatment. Or also it can be for a fracture or dislocation treated through traumatic wound or extension. Okay. And my question is that, Koda, was this fracture or fractured bones or the fracture site surgically opened or not. Did you see any documentation stating that the fracture site was open or exposed to the external environment or surgically opened? Was there any documentation? No, right? You can see the fracture site was washed with sterile saline and the bone was carefully realigned using a traction. There is no documentation that the fracture site was surgically opened. Yes, which means this is not an open fracture. This is a closed fracture. That eliminates option D. How are you all doing, Goddess? How are you all doing? It says perform. Yes, oh, even a closed fracture falls under surgery, minor surgical section. So it doesn't have to specifically say that it's a it's the closed treatment are it's we can't say that closed treatment are not a part of a surgery. Okay, always coders always follow the guidelines. So what did the guidelines say? For it to be an open fracture, it should be opened surgically. Fine. So that eliminates option D. Okay, yes, this is wonderful. So uh, let's look into the next code 27786 that is coding for a closed treatment of a distal fibular fracture without manipulation. Now again the question is that, and we have other code option A, both are coding for a closed treatment of distal fibular fracture with manipulation. So now again question is whether a manipulation was performed or not. We know that the definition of manipulation says that it's a reduction by application of manually applied force or traction, right? And yes, there was a documentation here. It specifically said the fracture site was washed with a sterile saline and the bone was carefully realigned using a traction. And that is your keyword, which means this procedure was performed with manipulation. And that eliminates your option C. We are left with two options, option A and D. B, both are coding for a close treatment of the distal fibular fracture with manipulation. Now we have to look into the second codes for both 20696 and 20692. 20692 is coding for application of multi-plane unilateral external fixation system. It looks like a good code, but if you read 20696, you can see that this is for an application of a multi-plane unilateral external fixation system with stereotatic computer assisted adjustment, including imaging and initial and subsequent alignment. So this is more specific. Yes, this is more specific, and that is our answer. So option B is also incorrect. Option A is the correct answer. I can see a lot of aha moments in the chat. I'm glad that we have learned something here. So great learning coders. Let's move on. Let's do another scenario. I hope you all are ready. Here we go. Exercise number 3 of the following, which CPT code most accurately describes the procedure. Your options are 28505, option B 28495, option C 28525, option D 28496. A 45-year-old patient presents with a comminuted fracture of proximal phalanx of the second toe after a heavy object fell on the foot. X-ray confirmed the displacement and angulation of the fracture fragments under general anesthesia. Under regional anesthesia, the surgeon makes a small dorsal incision over the fracture site, exposes the bone fragments, and performs a direct reduction using surgical instruments. The fracture is then stabilized with miniature screw, ensuring proper alignment under fluoroscopic guidance. After thorough irrigation, the wound is closed in layers and a sterile dressing is applied. Of the following, which CPT code best describes this procedure? Courtesy of time begins now. Okay, I will give you 1.5 minutes here. We are running out of time, so we have got few more scenarios to cover. So give your best answers, coders. Okay, give your best answers here, and your time begins now. All right, coders. Answers are coming in the chat. Some people are even changing it. Good. Let's review this scenario. Okay, here we have another patient who came with a comminuted fracture of the proximal phalanx of the second toe, right? And procedure inventory fracture treatment was again performed here. Now, what kind of fracture treatment is performed, coders? Is it an open, closed, or percutaneous? What do you think? What kind of fracture treatment was performed? Yes, this is an open fracture treatment, right? Yes, exactly. And you all know the definition by now. The site must be surgically open and was clearly documented. An incision over the fracture site exposes the bone fragments and performs a direct reduction. This is a open fracture treatment. All right, so no doubt on that. Option 28495 is coding for a closed treatment. That is incorrect. Option 28496 is coding for a percutaneous treatment. Even that is incorrect. And it eliminates option B and D. We're left with option A and C. So I did so. People are choosing between option A and C. There was a quite some traffic between option A and C. So if you carefully read the code language 28505, which is option A, is coding for an open treatment of the fracture of a greater toe. Okay, and 28525 is for an open treatment of a fracture of phalanx or phalanges other than greater toe. I think you all now got where you went wrong. Yes, so we cross check with our procedure inventory, diagnosis inventory. We know that it was not the fracture was not in the greater toe. It was on the lesser toe. So it was on the second toe. So this is not a greater toe. That makes option A incorrect, and the correct answer, as most majority of you have said, I see most of the people change their answer as well. It is going to be option C. Yes, 28525. Fantastic job, coders. You are doing a Great job here. So keep it up. Let's move on to the next one. Okay, here we go. Exercise number 4 of the following codes, which CPT mostly describes the procedure. Options are option A 29105, option B 29065, option C 29710, option D 29705. A 40-year-old patient presents to an urgent care clinic for removal of a long arm cast that was applied 3 weeks ago by an orthopedic surgeon following a humeral shaft fracture. The patient reports mild itching and tightness, but no complications. The urgent care provider carefully removes the cast, inspects the skin and limb for signs of irritation, and provides an aftercare instructions. No new cast or splints are is applied during this visit. Of the following answers, which best describe this encounter? Coders, your time begins now. Okay, Coders, all the best. And Coders, you all are on fire. You all are on fire. Yes. So here we have a patient who came for a cast removal, and Coders, if you look into the guidelines, it's clearly stated that if a cast is removed by someone other than a physician or qualified healthcare professional who applied the cast, then we can report the removal code. So yes, this procedure is codable. So that's something which we must always look for. And in our scenario, you can see that it was orthopedic surgeon who placed the cast, right? And it was removed by an urgent care provider. So it was two different physicians who perform these procedures cast application and cast removal. So we can code them. So option B is incorrect, which is coding for 29065, because that is for a application of the cast. Also option A 29015, that is also for an application procedure, even though that's not for a cast application, that's for a splint application. So both are, by the way, incorrect. We have only two options remaining, 29710 and 29705. Now 29710 is for a removal by valving uh, of a shoulder, hip or spica, and we had a removal of a long arm cast, right? So let's look into the next code, 29705, which is for a removal of a full arm or a full leg cast. So that is something more specific, and that is the correct answer. So I see only option D in the chat. Well done, well done. As I said, you are on fire. Let's quickly move on to the next one. Exercise number 5 of the following. Which best describe or most accurately describe this procedure? Option A, 28505. Option B, 28495. Option C, 28496. Option D, 28515. A 32-year-old runner presents after accidentally striking their foot against a metal post. X-ray reveal a displaced fracture of the proximal phalanx of a great toe. After administering local anesthesia, orthopedic surgeon performs manual manipulation to realign the bones using fragments. Using fluoroscopic guidance and percutaneous pins are inserted through the skin through the small skin punctures to maintain proper alignment during healing. No incision is made to expose the fracture site. A sterile dressing and postoperative shoe are applied of the following. Follow-up is scheduled in 2 weeks. Okay, coders, of the following, which best describe the fracture treatment codes? And you got 2 more minutes. All the best. All right, coders. So keep the answers coming. And meanwhile, I'm going to walk you through this scenario. So if you're still continuing to work, please continue. And once you're done, you can place answers in the chat. Okay. So here we have a patient with a displaced fracture of the proximal phalanx of the great toe, and procedure inventory. A fracture treatment of the proximal phalanx of the great toe was performed. Okay, now the question code is, what kind of fracture treatment is this? I would say this is a percutaneous skeletal fixation. Let's have a look into the definition of a percutaneous skeletal fixation. Okay, so you can see that in this procedure, the fracture fragments are not visualized, but the fixation, such as pins, screws, are placed across the fracture site, typically with image guidance. Wasn't that exactly what happened in our scenario? Yes, let's read the scenario once again. Using fluoroscopic guidance, this particular portion, a percutaneous pins are inserted through small skin punctures. There you go. There is your keyword. A percutaneous pins are inserted, and it was done using a fluoroscopic guidance. Also, it is not an open treatment. It was mentioned that the surgical site, there was no incision made to expose the surgical site. So this one qualifies for a percutaneous skeletal fixation, which means it's not an open treatment. That eliminates 28505. It eliminates option 28495, option B as well. Also not 28515, which is also coding for a closed treatment. The correct answer is going to be 28496, which is for a percutaneous skeletal fixation of a fracture of a greater toe, phalanx, or phalanges with manipulation. Excellent job, coders. Excellent job. How are you all doing? How are you all doing, Chorus? Let me know in the chat. Are we good? Okay, so I got one more scenario here. Let's check it out. Here we go. Exercise number 6 of the following. Which CPT code most accurately describe the procedure? Option A 20670, option B 20680 times 2, option C 20694, option D 20680. A 40-year-old patient returns for removal of orthopedic hardware from the right radius. Patient previously underwent open reduction and internal fixation for a radial shaft fracture 1 year ago. During the current procedure, surgeon makes a single incision over the previous surgical site and dissects through the soft tissue and muscle layers to expose the bone. A single T plate and one screw are identified at the fixation site and removed. The wound irrigated and closed in layers in a usual fashion. Of the following, which best describe the procedure? Otis, you got 2 more minutes. Okay, your time begins now. All right, Goddess. I can see some wonderful answers in the chat. So let's go through this. And okay, we have a patient here for an orthopedic hardware removal, and a single deep plate and one screw was removed from the right radius. So this is something you can see the image, how a internal fixation device looks like. And let's look into the CPT codes now. 20670 is for a removal of an implant superficial. Now we have to find out whether this is a superficial or deep implant removal. And from the documentation, it's clear that the doctor had or the surgeon had to dissect through the soft tissue muscle layer to expose the bone. Now, that is not going to be a superficial removal, right? That is not going to be a superficial removal. And also, it's mentioned that a single D plate and one screw was identified from the fixation site and removed. So, again, there is another keyword that indicates that this is a deep internal fixation device. That help us eliminate option A. It is incorrect. Now let's look at option C, 20694, which is coding for removal under anesthesia external fixation system. Now we all know that this is an internal fixation device, not an external fixation system or device. So that eliminates also option C. We're left with option B and option D. So I would say 20680. Option D is the correct one, as everyone said in the chat, because 20680 should be only reported once, as the original injury is located at one side, regardless of number of screws, plates, rods, or even incision. So 20680 times 1 is the correct answer. And multiple use of 20680 with a modifier 59 would be appropriate when the hardware removal was performed from another fracture site that is different in anatomy and unrelated to the first fracture site. So that was not the scenario here. And option D is the correct answer. You all are doing a fabulous job. Okay, so next I have some handful scenarios for you all. I know it's almost time, but if you still wishes to participate, you can. Okay, so you can now type your answers in the chat. Okay, coders, these are some guidelines, and let me see how strong you are on these fracture treatment code guidelines. Okay, we reviewed them in the initial stage. Now let's see. Which of the following best defines a manipulation in fracture or dislocation treatment? Is it option A, surgical exposure of a fracture, option B, reduction by manually applied forces or traction, option C, placement of pins or screw percutaneously, option D, temporary stabilization or for patient comfort? What say you, coders? As always, I say this is a rapid fire round, and as I expected, answers are coming in so fast. So fast. Yes, option B is the correct answer. You all are amazing. Manipulation means a reduction by application of manually applied forces or traction to achieve satisfactory alignment of fracture or dislocation. Awesome. Great. Let's look into the next one. Which statement about the closed fracture or dislocation treatment is correct? Option A, fracture was surgically exposed. Option B, the pins or the screws are always used. Option C, fracture site is not surgically opened. What say you, coders? Okay, remember, coders, it's a rapid fire round. Place your best answers in the chat. All right. Yes, I didn't have to wait much time for the answers to come in the chat. Absolutely correct. Option C is a correct answer. Here we go. Closed treatment. The definition states that the treatment site is not surgically opened, that is not exposed to the external environment, nor visualized directly. So great job on that one. Let's move on to the next. Here we go. External fixation may be used for option A, only open fractures, B, closed percutaneous open fractures or dislocations. Option B, temporary splinting for comfort. Option D, cast removal by another provider. What say you, coders? Let me know in the chat. Yes, you all are rocking it in the chat. It is option B. Yes, and the guideline states that external fixation may be used for all types of fracture. Can be also fracture treatments, fracture or dislocation treatment can be used for closed, percutaneous, or even open fracture treatment. Excellent, excellent, excellent. Next question. If a physician performs the initial fracture treatment but will not do the subsequent care, fracture care, which modifier should be used? Is it option A 76, option B 54, or option C 56, option D 22? What say you, coders? Okay, I can see only option B in the chat. And yes, indeed, that is the correct answer. If a person providing the initial treatment will not provide subsequent treatment, you should use a modifier 54. Okay, yes, so that is another important guideline. Next one. Casting, splinting, strapping used solely to temporarily stabilize a fracture for patient comfort. Is this considered as a closed treatment? Or option B, report as an open? Option C, not considered as a closed treatment? Option D, reported with modifier 76. What do you say, coders? Sorry. Okay, I think you all are thinking deep on this scenario. Remember the guidelines, coders. Oh my god, chat is on fire. And C is the correct answer. Casting, splinting, or strapping used solely to temporarily stabilize the fracture for patient comfort is not considered as a closed treatment. So that is a correct statement. Okay, we are going on to the final hand pull scenario for the day. If satisfactory alignment of a fracture or a dislocation is not maintained, the same physician performs subsequent re-reduction, which modifier should be appended for the fracture or dislocation treatment code. Option A 58, option B 59, option C 76, option D 77. So I've just mentioned, I've also given the description for these modifiers. What do you think, coders? Remember the guidelines. There you go. Yes, option C is the correct answer. And here is your guideline. Oops. Oops. Okay. If a satisfactory alignment is not maintained and requires a subsequent re-reduction of the fracture or dislocation by the same physician or same qualified healthcare professional, you have to append a 76 modifier to the fracture or dislocation treatment codes. Fantastic job, coders. You all nailed it. That's what I say. You all nailed the fracture coding. So, coders, if you enjoyed our video, smash a like button. Don't forget to subscribe, and you can also share it with someone who needs to see these videos. I hope you all enjoyed the session. I truly enjoyed, and you all did a fantastic job. I hope you also learned something new. And thank you for joining. Thank you, my team in the chat, for supporting the coders. Thank you, everyone. And we'll see you next week with another interesting topic. So we have placed the survey link in the chat. Please do fill that form and let us know how you feel. Okay. Okay, coders. So see you all next week. Till then, stay safe, keep coding, and happy and safe Halloween to everyone.